Everyone ready?
All right. Hello, everyone. Welcome to our first podcast, video, whatever it is that we're bringing you guys today, brought to you by Professor Rock as our end of the year project. My name is Knock.
I'm Aspen.
This is Hillary.
I'm from Brooklyn.
And today we are going to be talking about mental health behind human isolation. But before we begin, we want to say a disclaimer that this is our first time ever doing this, so if we suck at it, we are so sorry. And we just want to say that this is all research-based, so everything that we have or is going to talk about, we're basically taking it off of like good resources that are not Google and Wikipedia. Right, guys?
Right.
Okay. So going into today's topic, Aspen, can you tell us a bit about the history of human isolation?
Yes. So the beginning from the CDC, isolation was used since the 14th century, mostly in coastal cities from plague epidemics. I couldn't find anything that it was used before then, but it most likely was. And then it was practiced in a lot of Europe until obviously migration to America came in. And we practiced isolation here and there, I suppose, but other than that, it was more just for diseases and such. It wasn't till 1921 that the quarantine system was fully nationalized by America, and that gave more government involvement. Before then, it used to just be states would kind of just be up to them to do and take care of like diseases and other epidemics that kind of broke out. And isolation can be defined as the process or fact of isolating or being isolated. It can be defined as denoting a hospital or ward for patients with contagious or infectious diseases. An instance of isolating something, especially a compound or microorganism. But what we have done is we've kind of associated other words like self-isolation, loneliness, and a few others just to kind of group them with isolation. But by the very definition of isolation, it's mostly just used for epidemics and diseases. And again, America kind of came like in the foreground. We weren't really great at keeping things together. And another thing that people don't really realize is that socially, we've kind of practiced isolation without diseases. And such examples are Japanese internment camps, Native American boarding schools, and as of right now, immigration detention centers. We obviously don't say things like a disease, but we do treat those types of things like a disease, a group of people and such. In addition, this is important now because obviously all of us are going through COVID-19, first experience with a pandemic, y'all.
I know.
And
never before seen.
Never before seen, and we are practicing isolation and self-isolation, and that is, I think, a new concept for everybody to be experiencing. Because before it was just a concept, now we're in it together. And lastly, the reason we talk about isolation is because it correlates to loneliness, or people say that it's correlated. What many people don't know is loneliness, the word loneliness in the English language, didn't really come about until the 19th century. And it just means being without. And a lot of it was due to the Freud's psychodynamic model of loneliness has to be a mental health issue. However, in a TED Talk with Faya Alberta's A Historical Journey Through Loneliness, she discusses that loneliness is not only felt mentally, it is felt in other areas. It's a biopsychosocial type of idea. And we feel it physically, mentally, emotionally, and it affects us in all areas. But mostly loneliness is we've kind of just put it in one word when it's more than that. And I think Brooklyn has a little bit more information on that.
I do. So it was very interesting researching a lot like Aspen did, and just realizing that as a language, we utilize one term to mean a multitude of things. So at the moment, everyone's talking about social isolation, and which is more of an objective social contact type of thing, whereas loneliness tends to be much more painful, honestly, because it's subjective. It's an emotional state, and it's brought on by typically by different set of circumstances. It can be dependent on genetics, environmental factors, cultural norms, and social needs. And it's more about your perception as a person of what it is that you're getting and receiving from other people. You could maybe be getting a very high quantity of social interaction, and at the end of the day, it doesn't feel like enough for you, and you're lonely, and it's still valid. So there is a correlation between social isolation and loneliness, but they're not more or less synonymous. Social isolation can lead to loneliness, but they're not the same thing. Social isolation is obviously something that we kind of agreed to, and it was forced upon us. And so it's an objective thing, and it's defined as an adequate quality and quantity of social relations with other people at an individual group / community level. And let's see. I have so much to say about all of this. Okay. And I don't know if some of you out there have already experienced this or not. I know that in my household, we've kind of discussed how our bodies have been reacting to social isolation and like how it's changing. Just the other day, my mom was like, the days are so long. And I'm like, yeah, they're long. And then I went and did research, and I'm like, oh, Mom, you're not crazy. It's real. Isolation stretches out our time. In fact, one guy, he was a cave diver and went, and he was down there, I think, for like 300 days or something crazy like that. And from that, he changed his whole body's internal rhythm because he was in darkness for so long. So even though we're not living in darkness, even though we're not, in a cave, it's still, our houses are containers. And within those containers, we act differently because we're not interacting with the outside world. So our days may be longer, our nights may be longer. They both might lengthen. Researchers can't tell you why this happens. They just tell you that it does. Isolation also, at this level, changes your cognitive abilities. You're going to have issues focusing. I know I'm having issues focusing. It also deters your learning. So our learning capabilities, as we're, gotta love it, finishing up and doing finals, our learning capabilities are lessened at this moment. Simply because we're not able to really reorganize our thoughts in a cohesive manner because there's so much stimulus. At the dawn of crisis, our bodies are flooded with high hormones and with anxiety. So there's a lot going on. One of the interesting things that's different for this 2020 pandemic isolation versus generations ago, we have social media. I can sit here and see Knock, Hillary, and Aspen. And back in the day, we couldn't. But that also brings up, how comfortable you are with technology. The difference between, staving off loneliness is your personal perception of what counts as really high quality personal time with friends. For those of us who grew up with the technology boom, texting and Skyping and gaming with people from afar like this still counts as quality time with one another. For my grandparents who are really struggling right now, texting them just is not working. So we've had to FaceTime them multiple times a day just to help them get through this, because for them, the interactions they have through the phone aren't that same quality of interaction that they need to stave off loneliness in this time of social isolation. So they're feeling a lot more isolated than perhaps I am or the rest of us are, because of that gap in technology knowledge and usage. And so it changes things, and it helps, and it deters.
Yeah. Oh my goodness. I can totally relate to that because technology used to be, or is still very advancing right now. And it's so important that we have that right now, but it's so hard when our grandparents don't know how to use that.
Mm-hmm.
Crazy. Hillary, I'm curious about the difference between solitude and loneliness. I heard people say that they are alone, but feel lonely. And I've also heard people say that they need alone time. So what's the difference there?
Yeah, good question, Knock. As someone who is an only child and also an introvert, and I really need alone time to feel rejuvenated and to feel good. I've also felt lonely being alone, but I also must say that I've felt lonely hanging out in groups too. So I felt it in both situations. I've recently looked at a book called The Handbook of Solitude, and it talks about how solitude or isolation can be bad, and it also can be good. So some of the reasons it talks about how solitude can be bad are we're social creatures, and we have a basic human need to belong in this world and with others. Feelings of being ostracized, peer exclusion, social isolation, and then also feelings of loneliness coming up. And then some of the good things it talks about with solitude or isolation is that it can feel like a restorative haven. It can be a necessary escape. Solitude creates a unique venue for creativity and different religious experiences. And if you look at history, people have willingly gone on personal retreats and different pilgrimages just to escape being around other people.
Wow. So what are the pros and cons of solitude and isolation?
Yeah, so in an article that I read called Between Solitude and Loneliness, a Meditation, it talks about how loneliness has been described as a gap between desired and actual social connectedness. And it's caused by low self-esteem, shyness, fear of negative evaluation, and poor social skills. So lack of human company is not the sole cause of loneliness. So just like the article states, I think that it comes down to choice. So we as humans, we like to feel like we have agency and power in our world. And so when we're punished and we're put into solitary confinement or in quarantine, but we're wanting a human connection, then our choice is taken away. And we no longer have the power to make that decision. And I think that not having that choice creates suffering because we're no longer getting our needs met.
Oh my goodness, that makes so much sense because I'm alone all the time right now and I need human interaction.
Right, yeah. So there's also another side to it. So the other side is there are people who choose to live in solitude because maybe they want to. Maybe they're looking to find something during that time of solitude. But the key thing is they're choosing it. They're choosing to be alone and to stay quiet. Maybe they choose to be in solitude for a day, and then the next day they're wanting human connection, so they're able to reach out to a friend. And when they're wanting human connection, but they're not able to achieve it, I believe that's where the feelings of loneliness start to come in.
Yeah, that's so real. Mm-hmm.
And it feels like that's kind of what's going on for all of us right now. I know that because, you know, we haven't chosen to be in isolation, we've been told to stay in shelter at home. I know that I've been feeling it because I've really missed face-to-face connections with my friends and family, and I don't want to be in solitude all the time. This is not what I choose to do. So I've definitely found myself feeling lonely during this quarantine.
Yeah, I think a lot of people are feeling that way. It might be taking a toll on a lot of people's mental health right now.
Yeah, I definitely agree. And with the current need to stay at home right now, and then also not have any human connection, and then plus there's like this big fear of contracting the virus, and the uncertainty of it all just kind of mixed with feelings of loneliness, I think is definitely having an impact on people's mental health. Luckily, there are some ways that we can support ourselves during these tough times, which I think, Nok, you're going to talk about.
Yeah, but before we go into that, I want to go to our survey. So do you guys remember the survey we sent out like 3 weeks ago?
Yeah,
No,
how many
I looked
responses?
Yeah. So we had like 73 responses.
Right.
Pretty good.
And they all range from like 15 years old to 74 years old.
So
Yeah, I know my grandpa took it. Those are 70, yeah.
Nice. Yeah, so I was looking at it, and one of the questions that we asked was, do you feel your mental health has gotten better or worse since quarantine? And our graph says that 4 people said 1, as in like they've gotten worse. 11 people said 2. 38 people say they were indifferent, like in the middle, like it hasn't gotten worse or it hasn't gotten better. And then 15 people said they were like 4, and then 5 people said that it's gotten better. So our graph is basically like hyperbole. It's crazy.
I think I can kind of talk, like, for me, that kind of makes sense based off of what I read in research. You know, if you already have mental health problems like anxiety or depression or you know, some of the more severe ones in which you're already prone to hallucinations, this will for sure make it worse. And those of us who are, neurotypical, it would seem that we are easier able to create coping mechanisms in which we can make everything seem quote unquote normal. So for all those people who are like, you know, it's the same, it's like, it's probably not the same, but you were able to switch back to some coping mechanisms that helped you get through it. So that's incredibly interesting. I love that our survey has like dictated that.
Yeah. I'm so glad that we did it before we did any research, because I was so surprised that everyone was so indifferent about their mental health. Like, we're over here like, oh yeah, it's probably taking a toll on everyone, but it's really like, it's either or right now. They're either worse or they're better. So I'm also interested to see like what the results will be like after April 30th, whenever like it's been about a month and a half, and see where everyone is. Because when we sent out the survey, it was only the beginning, I think, of like this whole quarantine and COVID going on.
Mm-hmm.
All right. But so how's everyone doing during their time now on isolation?
I mean, I feel fine. But mentally, I've got a lot on my plate right now. So, but it feels nice not to go anywhere until you want to go hiking and you realize they closed all the national trails and such. And so it's kind of like what Hillary was talking about is there's a difference between self-isolation, and that's your choice, versus being told to. I do miss our awesome coffee dates and stuff, but yeah, just chugging along.
Yeah. I also miss them. I miss like having humans to talk to in person.
I think I'm one of those few folks who grew up with technology, and
I still think that my in-person friend time is better quality than over the phone. Like, this is still really fulfilling, but it would be so much better if we were, together in person. That feels so much better to me. So I am struggling a little bit with that difference between connection.
Yeah, definitely. So some tips and tricks that I actually kind of researched. I mean, like, I know self-care and taking care of yourself is something different for everybody. So if you're an introvert, staying home is like easy peasy. But if you're an extrovert, staying home is going to be hard, like me. So what I've done so far is, like, I've just been waking up every day and making sure that I start my day with brushing my teeth and just starting the day, because we can get so lost in our chill time that we forget to just, take care of ourselves physically and mentally. And then I also know that Aspen has like tips and tricks with animals.
Yes. So I do have
Some really cool research that animals they're helpful in the way that we've kind of had a history with them. Mostly dogs and cats, but I mean, I'm pretty sure there's some research out there that also incorporates like snakes, gerbils, spiders, whatever you want to make a pet, I suppose. But you could find a lot of great research on, it's called the Human Animal Bond Research Institute. A lot of the research, though, is done with elderly, which I kind of connect to Brooklyn's idea of the whole generation thing. A lot of pets actually do help the elderly because they are alone in nursing homes and such. But a few things animals are great for the biopsychosocial model. They get you outside physically. They help you mentally in a way that, if you're not really a great people person like myself, they're there. And they also release the oxytocin, I believe, to help relieve high blood pressure. Now, there also has been articles about how we research the animal bond, and some criticisms that we only research with the elderly, and that we kind of set it up in a way to succeed. But from personal experience, and you guys can probably talk to it too, as many people can, animals, for me, especially my two dogs, they help immensely. And so just being able to come home, and if you can go on a walk, if your apartment building allows it, or which they should, I don't know why they wouldn't, but just getting out there and actually seeing other dogs or seeing people. I mean, you don't have to go talk to them, but there's like a connection between animal pet owners, and you can go watch the cats sit in the window and like yell at people, So I would suggest some tips are just getting out there physically, because that has been researched to help oxytocin levels and endorphins. My bad. And then just snuggling with them as well. I mean, they can go from active to like sedative in like 5 seconds, unless you got a really abnormal pet.
Yeah, you don't want to snuggle with a tarantula.
I'm pretty sure, I don't know. Probably not.
But just being able to allow yourself that connection with an animal can help immensely, and especially for elderly generations. If they have pets, it will help.
Nice. Yeah,
So
but if you guys go outside, 6 feet apart, okay?
6 feet.
6 feet. All right. So another thing that I also thought it would help for others who are, going through this is like breathing exercises and meditation, making sure that your mind and body are connected still, because it's very important that your body is also physically taken care of and your mind is physically taken care of by breathing and making sure that you're physically in your body still. Like, we're all going through a traumatic time, and down the road, we're going to look back at this and, something's going to trigger like, oh, I remember that time when I was in isolation and I stayed home all the time and we couldn't work and we couldn't do this or we couldn't do that. And so it's very important to kind of use breathing exercises to take care of yourself. during this time. And then also, I think another thing that's important is journaling your experience, because, when are we, I don't want to jinx it, but when are we ever going to, live through another pandemic like this? I know that in the future, knock on wood. I know that in the future I'm going to tell my kids, like, you have it easy. I was at home for 2 months straight without being able to go anywhere, running out of toilet paper. Does anyone have anything else to say?
I can deliver some toilet paper to you.
Thanks. So, in closing, I think that unanimously, we think it's a tough time for everyone, right now. And we hope that these tips and tricks and, bringing out this information to the world can help you guys kind of, relax a little bit better and find ways to kind of cope with the situation, because I'm sure that we're all just trying to find ways and things to do while we're in this together, but not really together.
What is the hashtag? Hashtag alone together?
Yeah, hashtag alone together. Alrighty.
Thank you.
Thank you.
Thanks for listening.